I'm the Media Pass President for Staff Assembly, and I want to thank you for coming to this event this afternoon. The UCLA Campus Human Resources Department and Staff Assembly would like to welcome you to today's UC Benefits Town Hall. Open enrollment for health and welfare benefits will be taking place on October 28th through November 26th. As all of you may be aware, there will be a new menu of medical plan changes. Here to provide an overview of the 2014 medical plan offering and answer your questions is Michael Baptista, Executive Director of Benefit Programs and Strategy. Joining him is Kathy Hajopoulos, UC Health Program Consultant, and Mark Esteban, Director of Planning and Financials, to discuss the UC Care and Health Savings Plans, the two new plans this year. We also have the privilege of having Mark Peterson, who serves on the University Committee of Faculty and Welfare, Healthcare Task Force, and Health Benefits Work Group. Many of you, when you came in, you should have received a note card. What we will do is, if you have any questions during the presentation, write your question on the note card, and towards the end of the presentation, we will be collecting them, and the panelists will try to get through most of the questions. At the end, they will also put up the website where a lot of the questions, your answers can be answered. So also feel free to refer to the website also for additional questions or answers. At this time, I will turn it over to Lydia Ollier, our Director of Health Benefits here at UCLA.
Thank you, Tanya. Good afternoon, everyone. My name is Lydia Oller, and I'm the Benefits Director here for the campus. And I just wanted to take a moment to thank you all for coming and welcome you to this afternoon's event. And thank our guest speakers from Office of the President, as well as Mark Peterson, our faculty representative, who participated in the development of much of what you're going to hear about this afternoon. So, with that, I'll just turn it over to Mike.
Good afternoon, and thank you for having us here today. Today's presentation is mostly focused on the faculty and staff program. This program is also used by what's called pre-Medicare retirees. So if there are any Medicare people in the audience, we won't be going through it, but we will definitely take questions at the end. For the most part, the Medicare program is relatively stable. We did bid out our plans, and we'll be switching from Anthem to Blue Shield. But two of the plans that's originally in Anthem, the PPO Medicare and the High Option Plan, are pretty much similar in every aspect, because modeled after each other in the Blue Shield side of the house. So for the most part, if you're in those plans, you're just going to move forward to it. On the other hand, there is one plan on the Medicare side that we're no longer sponsoring, and that is the Anthem Plus Medicare program. And that one is not really our choice. What's not known to anybody out there is that for the last 4 years, we've been granted an exception by the Department of Managed Healthcare. And this year, the department said they weren't granting any more exceptions to us providing that plan. So we had to discontinue it. So again, I have Bridget here from UCLA. She's the healthcare facilitator. She is the expert on Medicare for this campus. And please feel free to engage her and us during this session or at the end of the session for any questions you may have on the Medicare side. So on this presentation today, hopefully by now you have read some of our communications, you've gone to our website, and you've gotten some mailings. You know by now that 4 of our plans are going to be discontinued, and instead we're putting 2 brand new plans up. We understand that change always brings about anxieties, and that's why we're here today. We're doing a some 34 sessions, 16-day whirlwind tour on every single campus, medical center, laboratory, you name it. We were going all over the state. Hopefully by the end of this presentation, you would have some of your questions answered, get some clarity on the whys and the whats, and hopefully we'll be able to address many of your issues and concerns. Your benefit staff at LA, together with 200 of their colleagues, attended a one-day webinar, one-day training up at Office of President. And they've all been, we shared everything we know about the programs. They've been given training materials, so they'll be able to help you together with us to make sure that any questions you have from henceforth will be answered. So with that, let me get to some of the changes for this year. Probably one of the first things everybody always wants to know about are the rates. What's it going to cost me? So if you've gone out there, the rate tables are all out there. And how many people here are from the Kaiser plan? Okay, so if you've gone out there, hopefully you've seen that your rate this year looks pretty good. Compared to last year, if you're in a single coverage, it went up by about $2. If you're a family coverage, it went up by about $7. Where's my blue and gold members in here? Good. Not that bad. $4 for the single coverage and $9 and change on the family coverage. So again, I think it's pretty manageable for monthly increases from this year to next year. What about the Anthem Luminos HRA plan? Do I have any in here? I got 1, 2, 3. Fantastic. 4. That's really the plan that requires a little more of your effort to look at it, but it really is becoming, it is one of the fastest growing plans in the country, and it has a lot of value to it. It has this term attached to it called high deductible health plan. It's scary. I get it. We're going to talk a little bit more about it, but if you really look at it and consider all the costs, premiums included, this plan actually has a lot of value. We like it so much that we're actually going to improve upon it. We're actually going to discontinue the Anthem Luminos Health Reimbursement Account, HRA is what it stands for, to the Blue Shield Health Savings Plan. It's still a deductible health plan, but it moves over to the lot of tax incentives as part of that plan. My colleague here, Mark Esteban, is going to talk a whole lot more about it. So hopefully by the end, you see that there's a lot of value in that plan too. All right, now let's go for the dreaded 3. Anthem PPO, Anthem Plus, and HealthNet Full Network. There you go. All right, that's why you're all here today. We're discontinuing those 3 plans. So I do have a bit of good news. In terms of your premium payments, no matter what plan you go into next year, you'll be paying less premium, less. Your check will go up next year. No matter what plan you move into, it will cost you less next year than this year in terms of the premium. Okay? So let's go ahead and go through the presentation now. So why did we discontinue those 3 plans? You can see up on the screen right now, for the Anthem Plus plan, our actuaries looked at our experience, looked at the trends in the market, looked at all the factors that would dictate what our new rate would be. And what they found was that if we were to continue Anthem Plus, we were looking at $64 a month for single coverage increase, $183 for family increase. Anthem PPO, $46,133. HealthNet Full, $64,182. So those 3 plans, that's what we were looking at in terms of plan increases if we were to continue for this next year. That's only for next year. What happens when plans take a big hit like that? Migration occurs, migration out of the plan. So now you even have a smaller base, which will actually drive rates even further up. In fact, in the last 3 years, when we look at these 3 plans from a system-wide basis, there's been a lot of migration out of it, which is one of the reasons why the rates continue to go up. We have no more strategies to cost contain these 3 plans. So this plan has returned into something where it's not good for you and it's not good for the university to continue, because bottom line is we end up paying the higher premiums. So this is just a quick lineup. On the left, you see over 2013, all the red ones are the plans that will be discontinuing going forward in 2014. On the right, that's our full plan lineup. The 2 green ones are the new ones, and I'm going to talk a little bit about them now. UC Care and Health Savings Plan. So one of the new plans we're going to introduce this year is called the UC Care Plan. It's basically a PPO plan. And my colleague Kathy here is going to come up after me and go into a lot more detail. but I just want to highlight a few things about it. It is the PPO replacement plan. So anybody in the Anthem PPO, this is a no-brainer. It has about 95 to 97% alignment of doctors. This plan was modeled or mirrored after the Anthem PPO plan, so the features are almost the same, but it's going to have a lower premium. So let me now just steal Kathy's thunder. Why does it have a lower premium if everything is so darn similar? Because we've been working with our medical centers for the last couple of years, and this year we were able to secure some very, very favorable rate concessions from them. That's what helped lower all of the premiums. So this plan has a lot of value to it, and for the Anthem PPO people in here, this is almost a no-brainer for you. If you look at it, if you look at the Blue Shield providers and the out-of-network providers, that mirrors perfectly into the PPO world, in-network, out-of-network. You guys should be completely familiar with it. Has the same 20/80 arrangement, $250 deductible, all those things mirror perfectly with it. And then what they call the select providers, I call the Uber tier. And if you go to doctors in that tier, you actually end up getting a copay instead of a co-insurance. Again, going very high level, very fast. Kathy's going to follow me, go into a lot more detail as to who's in those tiers. So this is the other plan we're introducing, is the Blue Shield Health Savings Plan. Again, it's a high deductible health plan coupled with a health savings account. So the high deductible medical plan, again, that's the scary, scary word in there. And again, don't be mistaken, it is scary. It's got $1,250 out of pocket. That means that you pay that first before this plan reverts to a PPO 20% payment. And then when you couple that with the health savings account, that's a way that has a lot of huge tax advantages. Mark's going to talk a lot more about it. What we did do before we even looked at this plan more is that we asked our actuaries to look at the PPO claims in 2012. That's last year's claims. Those are all the claims that already occurred. The doctors they saw, the services they got, the pharmacy that they received. We said, what if those people in the PPO plan was in this plan instead? How would their financials have been if they were in this plan instead of the PPO plan in 2012? And what they found was a vast majority of people, something like 90% of the people, would have fared better financially if they were in this plan instead of the PPO plan. Because when you put into account the premiums you pay, which this plan has a lot lower premiums than the PPO, and all of the other factors, financially speaking, this plan actually came out better for that one reason. Okay, so I just want to highlight that for you. Everybody in here who's in a plan that's going, that will not be continued, should be getting a custom mailing from us. And in that mailing, we want to talk about notify you one more time that the plan is going away, and that we would recommend to you plans that make the most sense based upon the plan that you came from. So in this case, for the HealthNet Full Network, if you're in that plan, we assume that you like the HMO environment, and that's a PCP, primary care provider, predictable co-pays. So we will map you to the Blue and Gold plan. Again, Blue and Gold plan and the HealthNet Full Network plan are identical plans in terms of plan features. Everything about it is exactly the same. Only difference is the network of doctors in each of the plans. It's the only difference. Okay? So if you're in the HealthNet Full Network, and if you want to go to a specific doctor that's no longer in the Blue and Gold, then you would probably not want to go into the Blue and Gold, and that's where we would then say UC Care or Health Savings Plan might be a better choice. And again, there's always Kaiser. So those are all options for you to pursue. Anthem Plus, totally understand. That's a plan that a lot of you like, and we like it too. That we've been sponsoring it for the last few years. The fact of the matter is that plans like this is called point of service plans, and not many insurance companies even sponsor them anymore. We were Anthem's largest customer for this plan, and I'm betting that in 1 to 3 years, Anthem's not going to sponsor this plan anymore just because the financials don't work well in it. We're one of the biggest, and because of that, we kind of lost one hole in the bag, right? And we're the biggest, and you kind of have a plan that is not doing well financially. You end up paying most of the costs for it. So again, this plan, we totally get it. You know, it has a lot of like the best of both worlds, right? An HMO payment, it's a PPO flexibility, wide network. We got it. But unfortunately, the financials do not play itself out. We just cannot cost contain this plan anymore. Because it's really a PPO plan at the end of the day, we mapped it to the UC Care. Again, it's another PPO plan, has a lot of flexibility. But if you're more sensitive to the co-pay structure and you really want to stay within that, you want to go to a primary care doctor and stuff like that, then Blue and Gold would be a good choice also for you to migrate to. Anthem PPO. To me, this one is really a no-brainer. If you're in an Anthem PPO plan, go to the UC Care plan. It really, UC Care plan is modeled after this. The plan features are very similar. The network is 95-97% aligned. The only thing you've got left is that the premium in UC Care is lower. So it's a win-win-win. It doesn't happen all that often. So this is a natural one for you. Anthem HRA, you heard me talk about it already. The HSA Health Savings Plan from Blue Shield is the replacement for this, and you pretty much need to move to it. And for the HRA people, if you have any monies left on the HRA accounts, your health reimbursement account, in order to preserve it, and UC will preserve that account for you, you have to move into the health savings account. Okay? Here's my last slide. Member priority. This is the slide that I need for everyone in here to think about. When you seek help from our benefits reps, from benefits counseling offices, it will sure make the conversation a whole lot easier. They will definitely be able to help you choose the right plan after you've made this decision. What is your priority? Do you want, or do you have a high need to stay with the doctor or doctors you have? The answer is yes. We have plans with your doctors in it. That's an easy one. If you're more sensitive to cost and you like the delivery system where you have a primary care doctor that helps navigate you, you have predictable co-pays out of your pocket, all those things, we have plans for you there too. So again, once when you have this question answered for yourself, the benefits staff here are here to help you navigate to the right plan. And our design for our plans are done such that we definitely have a plan that will fit you once when this question is answered. So with that, I'm going to turn it over to my colleagues, and they'll go through in more detail the two new plans.
So I'm going to spend a little time talking about UC Care. I'll share a lot more detail than the high-level overview that Mike just shared, but it's probably still going to be not enough detail. And happy to answer questions during the Q&A session. And again, as you receive materials at home and as you go on to our websites, it'll help kind of fill the story of what it is we're doing and how it can possibly meet your needs. So UC Care is a new plan. It's a new self-funded plan. Why the name self-funded is important is it gives us the flexibility to be able to define the benefits for our population. It means that we as the UC system are basically writing the checks for healthcare expenses as opposed to handing over the risk and the money to a health plan to do that on our behalf. And employers of our size have been doing this for many, many years. It's a first large foray into this for the UC system, and it's given us the flexibility to create a plan that incentivizes our members, our employees and their dependents to actually access care in the UC system. In exchange, our UC medical centers and medical groups have given us what we're calling a family discount just for UC Care members. And so we think it's a win-win for our entire healthcare system, our employees, our faculty, and their dependents. So here's the high-level overview. It's a three-tiered plan. We've called the tiers UC Select, which is Tier 1, Blue Shield Preferred, which is Tier 2, and then Out of Network, which is Tier 3. We're going to spend most of our time speaking about the first two. UC Select is the tier, again, where it's the UC Medical Centers, the associated physicians, and in some areas, like UCLA, where you're such a large county and geographic area, we've added a significant number of additional hospitals and physicians working in partnership with the UC Medical Center to ensure we have coverage throughout the county. That plan, if you stick to the UC Select level, it's a copay plan. So similar to an HMO in that you have a fixed copay as opposed to a co-insurance amount. What's different than an HMO, though, is that you are not required to sign up with a primary care physician. Whereas in an HMO, your primary care physician manages all your care, provides referrals for specialty and ancillary care. In the UC Care program, you can self-refer to any doctors you want, but it's still always a good idea to stay connected with your primary care physician because you want to make sure somebody's coordinating all of your care and understands the big picture. So not required, but still probably a good idea. The Blue Shield Preferred or Tier 2 level is like your typical PPO. You pay 20% co-insurance. It's of a negotiated rate, so it's not a bill charges. It's a very, very broad network that Blue Shield provides over 70,000 physicians across the state. The overlap with the Anthem Blue Cross plan is about a 98% overlap in the physicians that were in that plan and the physicians that are in Blue Shield. And it's a fairly large, robust PPO network. And then we've got the out-of-network component. If there's a doctor you really like who doesn't contract with any health plan and you still want to see that physician, you're able to do that, and you just pay a greater share of cost at 50% instead of the 20%. So here's a high-level look at some of the financials. As Mike said, the cost of the Anthem plans, the Plus and PPO plans in particular, were going through the roof. And what this shows is the 2013 rates for the single and family rate, and then to the far right, you could see the UC Care rates for 2014. And not even looking at the increases in 2014 for those plans, had we moved forward with those two plans, which you could see those below, you can see that UC Care from a premium perspective is still a lower cost option from a monthly premium for individuals and family members. How do the benefits compare? So that was the monthly premium. How are the benefits similar or different? As you can see here, looking at things like the deductible, the out-of-network, and the out-of-network number is a very important number, especially for those of you that are in a HMO and are thinking about moving to a PPO. And on the HMO side, much more predictable. Your $20 copays that are what you pay for most services, and you're protected if you have a catastrophic event. Whereas a PPO, 20% is a little scary. 20% of what? And as much as many folks for many years have tried to get more transparency around provider pricing, it's still something that we have not achieved. So the 20% is sometimes a scary number, but it's important to understand the out-of-pocket maximum. So what that means is once you pay up to that amount, all your deductible, your copays, your co-insurance, if you hit those out-of-pocket maximums, so on the Anthem plans, it was $5,000 for an individual, $15,000 for a family under the Plus, and then $3,000, $9,000 for the PPO. For UC Care, in the PPO, the preferred Tier 2, it's $3,000 and $9,000, so similar to the Anthem PPO. But the UC Select, to the far right, the out-of-pocket maximum is $1,500 for an individual and $4,500. So regardless of what that 20% payment that you would end up incurring for a variety of services, the maximum you would pay out of pocket is $1,500. So it's an important number to understand. On the deductible side, again, the deductible is what you have to pay out of pocket before your health care benefits truly kick in. On the UC Care side, in the preferred or Tier 2, the deductible is $250. And on the UC Select, again, the UC Select is that Tier 1, the UC providers and other high priority providers, there's no deductible. Your benefits kick in at day one. And then the other services underneath, looking at the member share of costs, again, the flat $20 copay in the UC Select tier versus $25, which those of you that were in Anthem Plus were paying, and then 20% for and 50% for network or out of network. Cool, thank you. That's good. My little pointer. Didn't notice that. That's good. And then on the hospitalization side, again, flat $250 copay on the UC Select to the far right, which is very similar to the Anthem Plus copay, and then 20% for the Blue Shield Preferred, same as the Anthem PPO. So very similar benefits, lower premiums. More details on the UC Care plan design. Again, not comparing it anymore to the previous plans, but looking at what we're offering going forward. And again, UC Select Tier 1, the Uber tier, as Mike called it, which is the UC Medical Centers Associated Providers, and I'll show you a list of the providers in the LA service area. Flat, copay amounts. Preventive services are actually at no charge to you for any or all plans we offer. The new federal legislation, Obamacare, actually is it's one of the mandates that preventive care for men, women, children is covered at 100%. So that's actually a really nice change. And then you can see some of the other benefits. Essentially flat copays on the UC Select Tier 1 and co-insurance for the Blue Shield Preferred Tier 2 and then the outer network. Although we feel the Blue Shield PPO network is so broad and robust, you're probably going to have very limited exposure to the outer network pieces of it. Again, just reiterating the network, we've worked very hard for the last 9 months with all the UC medical centers, their managed care directors, to negotiate this family rate, if you will, to identify other physicians to supplement that network, and then to work with Blue Shield to ensure everything gets loaded in the system in time, which it's not yet loaded. That question will come up. We'll talk to you about some tools you can look up if your provider's in or out. It's still a work in process, but we're working on it as fast as we can. The last bullet there around the Blue Card network, that's a network that's actually currently available through Anthem as well. Anthem, Blue Cross, and Blue Shield of California, all the Blue Cross Blue Shield plans belong to a national organization, and they leverage that purchasing power, if you will, to collaborate on some things and compete in most things. But the Blue Card network is actually a national network. So if you have kids who go to college out of state, or someone that's one of your dependents that's out of state, it actually provides in-network coverage nationally, which is a nice offering. And so here's the Find a Provider tool, we call it. The default, if you were to go out to this URL, is actually the UC Care, the UC Select, so the Tier 1. So the first group of providers, if you start searching by zip code or by specialty type, will be the UC Select Tier 1 providers. You have to go in under Select Your Plan and change it to see the Blue Shield Preferred, so that's the much broader network of providers that are in that Tier 2 PPO network. So you just have to change the search criteria to see which tier your provider is in. And again, this is a work in progress. Our goal is to have it as up to date as we can by the time open enrollment kicks off on the 28th. So which providers here are in that UC Select, the Tier 1, the copay tier? So here's a list of providers throughout the LA County area, north and south and east and west. And it was in alpha order, that's why UCLA doesn't come up till now. And you can see it's a very broad network of hospitals, and their affiliated physicians that refer to those hospitals or have admitting privileges will also be included. The one thing to keep in mind when you're using the tool for UC Care or the PPO product that Mark, the Health Savings Account program that Mark's going to talk about, the physicians are at the individual physician level. So if you're used to talking about a medical group, you're not going to find the group names in here. You're going to have to search by your individual physician's name to see if they're in there as opposed to the broad group, because that's just how PPO products work. They're not contracted at the group level. A couple hospitals that I know some of the UCLA physicians have recently affiliated with, more kind of up the 101 corridor, Los Robles and West Hills, are going to be in network at the Tier 2 preferred level, but their prices were much too high for us to include them in the UC Select level, so they'll be there at a co-insurance level as opposed to copay. So I just talked really fast. I shared a lot of information with all of you. These are some of the UC Care specific websites that are all able to be accessed through the broader Office of the President HR website, which we'll put on there at the end. I also have some cards we have at the front table and here around the concierge we have for the UC Care program. Because it's new, because it's unique with the 3 tiers and the UC tier, it may be confusing. We actually have a designated team at Blue Shield that's been working with us that's very well versed on plan design, on the providers that are available in our network, and continuity of care issues. So it's a really good resource in addition to your local benefit staff that can help answer questions should they come up. And with that, I will turn it over to Mark.
Good afternoon. Can you hear me okay? Insurance after lunch is always an interesting combination. So I'm Mark Esteban. I'll be talking about the Blue Shield Health Savings Plan. And as Mike mentioned, this is a replacement to the Anthem Luminos Health Reimbursement Account product. And I think Mike also mentioned that it's the lowest cost premium plan that we have in the portfolio for 2014. It's even less expensive than Kaiser. And there's some interesting aspects to the plan, one being a health savings account, which I'll talk about in more detail as we go forward, but it allows you to, on a pre-tax basis, make contributions and pay for immediate expenses as well as build a fund for future expenses. So that the Blue Shield Health Savings Plan, it's a combination of 2 products essentially. One is a high deductible PPO, which Mike mentioned is the deductible for individual is $1,250. And then it's paired with a health savings account. And now the health savings account is not like the flexible spending account that you might have through Connexus where you have the use it or lose it rules. The health savings account is a different vehicle altogether. You don't have to worry about use it or lose it, and the money is yours to keep. It's in your own account. If you leave the university, it goes with you. And I'll talk a little bit more about the benefits of the product as we go forward. So the medical PPO high deductible plan that's attached to the health savings plan is, again, $1,250 deductible for a single, $2,500 for family. It has an out-of-pocket maximum. For single, for instance, if you, between your deductible and the 20% co-insurance, you hit $4,000 and the plan pays 100%. And then, as with all of our plans, preventive care is covered at 100%. So another unique thing about the health savings account is the university is going to be contributing money into your account if you enroll. $500 for individual, $1,000 for family. And then the IRS sets limits as to how much you can have in a health savings account in a given year. And so for 2014, you can see the maximums are $3,300 for single, $6,550 for family. But since the university is putting some money in your account, you still can put up to $2,800 on your own end of the account, or $5,550 if you're in the family plan. And so with their tax benefits to the product that I'll describe in a bit, but one of the main things is as you put your money into the plan, it's done on a pre-tax basis, so you don't have to pay for federal or FICA taxes, which is nice. California is one of the 3 states in the nation that don't provide tax favor treatment to the health savings account, so that will be California tax. There will be tax on the California side of it, but our payroll system and Health Equity, who's the vendor who administers the health savings account, will take care of that for you. I guess one other thing about the health savings account is administered again by Health Equity. It's the largest administrator of health savings accounts in the nation with over $1 billion in HSA assets. And when we went through the bid process, one of the things we were really pleased with was that they have 24/7, 365 customer service. So no matter what time of day or night or what day of the year, you can access their customer service folks if you have tax questions or want to know how to best use your health savings account that's attached to this high deductible PPO. So how does the HSA work? Again, if you enroll in the plan, we're going to put $500 into your account, or $1,000 if you're in the family plan. You can contribute up to the $2,800 or $5,550 on your own. That's optional. And then if you're 55 or older, you can contribute another $1,000. then you're going to be using those HSA dollars to pay for your deductible, your co-insurance, the 20% or whatever, and any IRS publication 502 expenses. So with this health savings account, it's not just for the PPO product out of pocket. You can also use it for dental, vision, long-term care premium. So it's akin to a flexible spending account, but it's much different in that you don't have to worry about use it or lose it. The money rolls over year to year, so it just keeps growing. It doesn't shrink over time. It just grows, and so that's a nice feature. Since it's an IRS product, there are some quirks to it that you have to be aware of. You can't participate in the Blue Shield Health Savings Plan, which has this health savings account, and also be in a flexible spending account. So the Connexus plan and this product, you can't mix. The Connexus flexible spending account, you can use with any other product. However, if you're in Kaiser, UC Care, the HMO, you can still have that flexible spending account. A health savings account cannot be attached to those other products, though. The IRS requires that you can only have the health savings account with a high deductible plan. So just a little nuance there, but everybody would like to have this health savings account to apply to any product, but we just can't. Another feature, you can't be anyone's tax dependent, and I already mentioned the third one there. So why is the health savings account better than the HRA? Again, you own the account. You can contribute to it. You're making contributions pre-tax. As interest accumulates on those investments that you have in the HSA, they accumulate tax-free, so you're not taxed on the interest income. And then if you're taking the money out for qualified medical expenses, there's no taxation when you take it out. So it's triple tax advantage is the kind of term that they use, and it's kind of unique. I mean, 403Bs, IRAs don't have that kind of benefit either, because you may put it in pre-tax, but you're taxed when you take it out. But this is a pretty unique feature here. The product comes with a debit card. So if you're in Connexus currently, you may be familiar with the debit card they use. And this product has a health savings account debit card, but you don't have to worry about the money being forfeited like you do with the spending account. And as Mike mentioned, if you're currently enrolled in the Anthem Luminos plan and you have a balance, we're going to protect that balance, put it into a separate account that you can use going forward. So for any of those that are currently in the plan, no worries about losing those monies. So kind of the practical way this works is if you enroll in the plan, you're going to get two cards. You're going to get the Blue Shield medical plan card, and then you'll get the health savings account debit card. You'll go to your doctor and have services provided. The doctor's going to submit the claim to Blue Shield. They'll apply the discounts. Blue Shield will send you an explanation of benefit to let you know how much you owe the doctor. But at the same time, Blue Shield will send the information to Health Equity, who's the health savings account administrator. So you'll go online, you'll see how much money you have in your savings account, and you can push the button and pay that out-of-pocket expense right there. And then the other more common example is if you go to the pharmacy, purchasing a drug, again, you're going to give the pharmacist your Blue Shield card. They'll apply the discount, and you can pay for the drug immediately using your HSA debit card. But some individuals, both on this and on the medical side, you can, if you want, use your credit card to get miles or points and then reimburse yourself later. So there's some kind of unique flexibility to the product. And Health Equity currently has information up on our website that you can get through At Your Service, and I think I'll be putting that up in a minute, but they have a number of short videos as to how the product works, the health savings account, and what advantages there are to the product, and frequently asked questions. There will be people around open enrollment ready to take calls to answer any questions you might have. So that kind of concludes our three presentations, and I think we've got a number of cards that we'll be looking at and getting your answers out to you here.
Go ahead.
Okay, while we're still collecting, while we're still collecting cards out there, let me address some real quick questions. So we're not doing a comprehensive change in benefits, because if we do that, everybody's here till 5 o'clock today. I mean, just because there's a lot of stuff. The UCLA benefits, people will be will be going to a lot of the departments talking about the changes, but for the most part, there aren't any real big drastic changes. We are improving a few things based on the ACA laws. More preventative stuff will be in it. We also put in smoking cessation programs to support the president's initiative. So for the most part, I think most of the plan changes, if we have any, are really on the positive side. I didn't mention much about dental and vision. The university continues to pay 100% of that. Pretty much the benefit levels there remain the same. So in most areas, your disability insurance, all your insurances remain relatively stable. We're not seeing any changes there either. So again, I try to go top of my head here, but I'm not here to talk about every change, because again, we'll be here till 5 o'clock. Couple of questions on the Health Net Full plan. Again, that is one that is being discontinued, and if your doctor is not in the blue and gold, you're going to have to make a decision whether to stay in the blue and gold and choose another doctor, or to go find another plan. The doctor lists are out there for the most part. The blue and gold doctor list looks just like last year. There might be some minor improvements in terms of 1 or 2 small plans have joined it, but for the most part, if your doctor was there last year, it's going to be there this next year. Okay, those are the blue and golds. What does mental health look like? It's about 6 feet tall, wide. It continues to be provided by Optum, United Behavioral Health Program. It is a carve-out program. Again, for the ones, there's something called health parity. It's a federal law in which the carve-out health benefit has to be in parity with the medical program. What does that mean? So if you're in UC Care, let's say, UC Care has an in and out of network component. Therefore, the behavioral health has an in and out of network component that goes with it. If you're in Blue and Gold or Kaiser, which is an HMO, which only has an in-network, then you must stay in network in the Optum Behavioral Health. You don't have an out-of-network choice. So that's a health parity law in which we have to keep whatever the features of the medical plan and the carve-out mental health program together. So that speaks a little bit on the mental health side. So you ready to do some?
Does he have any?
All right. Mark doesn't have any, so let
Okay,
me.
so I'll go ahead. Doing my homework here. Okay. Lots of questions about what constitutes preventive care, or am I on?
Yeah, no, these are really.
Can you
really
guys hear me?
soft.
Okay. What constitutes preventive care? How do you define preventive care? Is that better? Ah, okay. So preventive care, and I just pulled it quickly off one of the benefit summaries we have. It includes well baby care, routine physical exams, which includes diagnostic x-rays and labs related to that routine physical, routine GYN, including mammograms and pap smears, prostate cancer screening, hearing exams, immunizations. At a high level, those are some of the general services that are covered under preventive care. Related question, does no charge for preventive care include lab work? Yes, if it's part of the routine physical exam. So again, diagnostic x-ray and lab is included. We do have a question out there around lab and x-rays, MRIs and such. If you are referred to have multiple tests on the same day as part of a physical exam, are those covered? Is that one copay? Is that multiple copays? And that's an outstanding question we are still researching. That's another, what is preventive care? So we can answer more questions later, should they come up. Someone says, if I'm in Agora and suddenly need hospitalization, do I pay Tier 2 costs since Los Robles is nearest hospital? Assume I have UC Care Select. So yes, you would pay at the Tier 2 level because that provider is at that Tier 2 preferred level. So when you enroll in UC Care, you actually don't enroll in a tier. You don't enroll in UC Select, you don't enroll in preferred. You enroll at UC Care, and then at the point of care, so when you're accessing services, whether it's hospitalization or a primary care physician or a specialist, at that point in time, you pay your copay or co-insurance depending on which tier that specific provider is in. So it's like your traditional PPO where you always check to see if someone's in network or out of network. It's the same thing, although we've added now one more tier, this UC Select tier. So in this example, Los Robles is in the preferred tier, 20% co-insurance would apply for that provider. Another question around pharmacy benefits under UC Care. So the retail pharmacy benefits, $5, $25, and $40. So again, generic brand and non-formulary. We do have mail order available under all of our health plans, and that would be $10, $50, and $80. So 2 times the copay, but that's for a 90-day supply versus a 30 or 60-day supply. And the UC campuses that also have pharmacies on site, I believe for all of our plans, will also be providing 90-day fills at the retail. So it's like a mail order price for you all, but you could walk up and get that 90-day supply at our UC pharmacies, which I think is a benefit a lot of folks have liked. Go ahead, and I'll get back on.
Okay, I got some general questions. What about Deb Care? Again, nothing's changed there. Does UC Care not have a HSA? Again, as Mark commented, an HSA is a wonderful thing, huge, great tax advantages, all those things, but it's tied to a high deductible health plan. You must be enrolled in a high deductible health plan to enjoy the tax advantages of a health savings account. Okay? Those are kind of tied together. Let me hit a couple of Medicare questions. So again, Medicare, again, is only if you are currently employed, if you're currently working for UCLA, whether you or your spouse is over 65, you continue to be in the employer plan. It's only when you retire, that's when Medicare kicks in. In fact, Medicare gets very annoyed at us if we were to put you in the Medicare program because the federal government is the primary payer of a Medicare world. So they would be very annoyed at us if we put you into a Medicare program. Saves us a lot of money, but as long as you are employed, you and your spouse will remain in the faculty and staff program until you retire. Okay? Again, and when that happens, part of the retirement transition, there's a lot of paperwork that needs to be done, but we'll take care of you then. Got some general questions on Anthem Plus. Well, actually got one of them talking about what's the difference between UC Care and the Blue and Gold. So where do we start? As Kathy just talked about it, UC Care is a PPO, okay? In network, out of network. I mean, that's pretty much what it is. If you happen to go to a doctor that's in the select group, you will pay a copay instead. That's what UC Care is. Blue and Gold is an HMO. Blue and Gold only has copays. Blue and Gold requires that you have a primary care physician at the very front that coordinates all of your care. Blue and Gold is an HMO again that requires that any specialists are referred to by the primary care physician. Again, it is a network of doctors. You tend to be attached to a medical provider network. It's an HMO world. UC Care is a PPO world, very wide selection, pretty much all the doctors you can ever think of. Depending on which doctor and which provider you access, it will then determine whether you're paying a copay or a co-insurance. So that's the best I can do to describe the difference between the two. One's a PPO, the other one is an HMO. The harder question is, I currently have an Anthem Plus. What's the best plan for me to go to? Okay. Again, I have to refer you back to my last slide. Tell me first, what is your priority? Is it your doctor? Then I would say probably UC Care or the Blue Shield Health Savings Plan will almost for sure have your doctor in it. Are you more price sensitive and you want to remain in a predictable copay, you want a primary care physician, then Blue and Gold, Kaiser, those kind of plans work for you. So again, once when you can answer that first question, then we'll be able to direct you to the right plan. I got another Medicare question, but I'm not quite sure if it's phrased correctly. What is the best plan comparable to Anthem High option? So the Anthem High option is not going, Anthem is going away, but it's going to be replaced with a Blue Shield High option. So basically, if you're in the Anthem High option, go to the Blue Shield High option. If you're in the Anthem PPO Medicare, go to the Blue Shield PPO Medicare. Those programs are modeled after each other. Okay? Want to take back some?
Okay. Okay. Does UC Care cover expenses for chiropractic and acupuncture services? Yes, it's a 20% benefit level up to 24 visits a year, which is combined chiro and acupuncture. So there is a benefit there. Second question on this card is what company is used for UC Care mail-in prescriptions? So we'll be using the Blue Shield Mail Services Program. For those of you that have Anthem are probably using Express Scripts. My understanding is for those folks that are on chronic medications and use the mail order service, there'll be a transition period. It's not like December 31st, you'll no longer be able to get your prescriptions. There will be a transition period between Express Scripts and Blue Shield, and they will, I believe, will honor some of those earlier prescriptions before asking you to get new prescriptions and start over. So there will absolutely be a coordinated process to move to the Blue Shield mail service program. This one is for UC Care. 50% is paid by employee through coinsurance. I thought you couldn't have double coverage. I'm not sure exactly what that means. It's not double coverage. The 50% coinsurance is if you access services out of network. So, outside of the Blue Shield preferred network of 70,000 physicians in the state, if you have your own physician you want to see, then you would pay 50% of those costs. If you go in network, so tier 2, the Blue Shield preferred tier, you'd pay 20%. And then if you go in the UC Select tier, you'd pay $20. It's not double coverage. I'm not sure what that means, but perhaps a person could come ask and talk to us after and we could help clarify that. Okay. All these UC Care questions. This question is with UC Care, can I get treatment when abroad? The answer is yes. It's through the Blue Card network that I mentioned that, I actually talked about the national coverage, but there is international coverage. There is a Blue Card access number that you could contact, before you go abroad or if something happens when you are abroad, and they can help you identify who their network providers are or how to submit claims and all of that. So there's definitely coverage. It was very important for our faculty, for sure, to have that.
If I can interrupt here.
Yeah.
So that would probably be one of the bigger distinctions between UC Care and HealthNet Blue and Gold. HealthNet Blue and Gold and Kaiser are both California plans. They're an HMO network. UC Care, Blue Shield Health Savings Plan, are PPOs, and they have a much wider network. And if you have a need to have care outside of California or even outside of the country, those are probably the two plans that work best for you. Now, first, I want to say all of our plans, even Kaiser and HealthNet, will cover you for emergency care outside of California or outside of the country. For emergency care, all our plans cover you. But if you have more of a snowbird or you're on some sort of a leave where you're spending like 6 months in another state, then UC Care and Blue Shield Health Savings Plan would be the better choice. Or if you have a child going to college outside in another state and you want your child to continue having health coverage, that would also be a better option for you. Okay?
I've got a couple of questions here. Is UCLA still a provider for Cigna and other Blue Shield plans from other employers? And you kind of have to check with those specific plans to see what the network is. We don't kind of track what other employers are including in their networks. If you have a family member who lives outside of Southern California and gets health care both at UCLA and in other areas, what is the best plan. HMOs, probably not. So I would say either UC Care or the Health Savings Plan would be a good option if you want to look at both of those. Let's see. There's a question about whether any of the plans cover obesity surgery beyond lap band surgery. You know, I'm not recalling right off the bat, but there'll be information either online or contact the vendor, Blue Shield, Health Net, whoever you happen to be with, to determine what benefits beyond lap band surgery are available.
Okay. Question is, I want to know if USC hospital and doctors are in UC Care Select.
All right, who asked that?
I actually don't know. It has not come up on any of our lists so far as being requested. But if they're, I know they're not in the UC Select for sure.
That would be really bad.
I could see the UCLA folks saying, yeah, bring them in. They may be in the Blue Shield Preferred, and the Find a Provider tool would be the place to go look for that. The second question on this is, what is the difference between professional services and outpatient services? It's a very common question, actually. So professional services, when you look at the benefit, that means physician services. And outpatient services usually mean the hospital or facility-based component of it. So if you're getting an MRI, there will usually be, or there'll always be, a facility component, so the machine where it sits in the facility, and then the professional component is the radiologist, the physician who's reading those scans and interpreting the results. So that's the professional piece is the physician. The outpatient services is the facility piece of that. Sure.
Right now you get two bills, one from the physician and one from the hospital. So is that going to be combined into one?
I knew that was going to come up. So that is an issue. It's unique to academic medical centers. It is something we have been trying to address with the managed care directors at each of the UC campuses, and essentially what that means, so that's a different issue than what I explained. Yes. So but we actually are pushing really hard to change that. So what you're asking about is different. So the professional and outpatient services, if you have an MRI, those are valid facility fees and physician services. What you're talking about is you go see a hospital-based physician and it's an outpatient visit and you end up with a facility fee and a professional fee. Again, academic medical centers tend to do that. They've been allowed to do that by the federal government for many, many, many years. Some of them waive that fee for certain relationships with certain people. We think families should have it waived, being in the UC Select network. It's a very real issue. You, the patients/members, are the ones that end up paying more. And we are working very hard with the group of the statewide UC managed care directors to try to address that. It's a very real issue and concern. I hear you.
So if I see a doctor in UC hospital, and they want me to go to MRI, should I pay $20 or pay 20%?
So that's another very good question that's outstanding. So right now, the facility component is at $20. The way the benefit plan looks, if you've seen anything online, it actually indicates you would pay 20%. That is actually an outstanding item we are looking to possibly change because not all, so the UC Select benefit level had to include benefits that were available across all the UC medical centers consistently. So things like skilled nursing facilities, hospice, ambulance care, those are not services that all UC campuses provide in-house. So we put those at the preferred level, the 20%. The lab services were in that kind of iffy category. What we understood were that some UC campuses may contract out some of those services. So instead of in-house lab, they may contract out to LabCorp or Quest, some other vendors. But now we're learning that may not actually be appropriate or the case. So we're actually researching that, and if we change it, it would be $20 if you come to UC and 20% if you go to the preferred level. But that was a very long answer to say, we're working on it, I don't know right now. Okay?
Yeah, I will take MRI or laboratory in UCLA hospital, but it's ordered by doctor in UCLA hospital.
Yep.
Yep.
So what should,
We don't know.
We don't know.
The answer is I don't know. I don't know.
it will be available?
Before October 28th, when open enrollment starts. Yes.
How can I know the answer?
It will be online. The benefit plan will show that. So you'll see the UC Select, it's a document that kind of looks like this, and it'll say right now, CAT scans, MRIs, it says, covered under the Blue Shield Preferred, which is 20%. If that changes, it'll change. It'll say $20.
We will probably also put it in our questions and answers. There's a QA section on it, and this has come up a few times, so we'll probably put it in that section too.
Yeah. No, it's an issue. Yeah, absolutely an issue. Okay, this question is, do drugs count in the deductible? How are they handled in UC Care? No, so there is no deductible for the pharmacy benefit, but then if you do pay for drugs or prescriptions, it does not count towards your medical deductible. This year, they're staying separate. Can I still get 3 months supply at UC pharmacies? Yes. And then I think I answered this, what pharmacies are used for mail away, and that's the Blue Shield mail program. Okay.
Well, this is definitely a Friday afternoon because on the morning session, we got this. And you guys are quiet, which is great. So at this point, we'll open ourselves to some questions from the floor. Okay, I'm not going to find them, so.
So just ask. What is
Just
the
ask,
question?
yeah.
Oh, Jill Stein.
Jill Stein.
Institute.
And it's a UC, okay.
It's the I Institute.
Okay, I will follow up on that. I don't know. Yeah, okay. The Jewel Stein Eye Clinic?
I Institute.
Eye Institute was not on the select list.
Okay,
Okay.
we'll confirm.
And another question was, I heard a lot about a 40% tax on so-called
Cadillac tax, correct?
any of these cars.
No, not at this point.
That-
And that doesn't go into effect until 2018. So we have some time.
So to connect that
and I'm-
question up, is that's one of the reasons why we discontinued the 3 plans that you saw up there. Those we're almost 98% certain will be subject to the Cadillac tax. The 3 plans that we discontinued. So that's another reason that drove us to eliminate those 3 plans, because they will be subject to the Cadillac tax. Okay? All right.
According to the UC plan, if I need to see a specialist, now I have a back pain, and I want to see orthopedic, I don't have to get an authorization anymore. Just go see him,
So-
$20?
Yeah, so the question was if you want to self-refer to an orthopedic surgeon for back pain, can you do that? And the answer is yes. And you pay $20 if you self-refer to an orthopedic surgeon that's in the UC Select Tier 1. If the surgeon or the orthopedist is in Tier 2, the preferred, then you pay 20%.
Okay, assuming he's in tier 1 and he says I need to have to get an MRI. In the past, I've never paid for that MRI.
You will pay for the MRI, either $20 if you come to a UC, pending the outcome of the other issue, or if he refers you to an MRI center that's a freestanding MRI that's not related to UC, you would pay 20% then of that MRI.
But if it's within UC, it's only $20?
$20, and you may have an additional 20% for the physician piece. That's the piece we're trying to resolve right now.
Time can end up being more expensive.
It can.
It really can. I mean, initially we're paying less monthly, but at the end of the year, what happens to you?
Yes,
Correct.
yes, correct. Yes.
Did I understand correctly that if you, that most of the say you're currently in the Anthem Plus, and so you've been using the HMO component through UC, so you could assume that most of the doctors employed by UC would be
Yes, we could, yes, not 100% though. There are some that are not yet signed on. So I would encourage you to look on the website to make sure the ones that you've been using are in there. Because it's not 100% of the UCLA docs, and I really don't know why that is.
I would say that for the most part, all the ones within UCLA proper are in. The UCLA has now expanded to the Valley, and there's 3 new ones out there. 2 of the 3, almost for sure, are not in for next year. Okay?
Okay, but most of the ones on the UC campus
Proper.
Oh, yeah.
They're
Oh,
in.
yeah. Oh,
They're
yeah, on
in.
the campus for sure.
Correct.
transferred over.
Yep, they're all in.
And all the problems that existed with Blue Shield, with the contract negotiations that went on, those are now gone away. We now love Blue Shield.
No comment.
Go, do you want to?
Those who lead up to UCLA Family Practice Development Group have said to me that their relationship with Blue Shield has been very good. They've been working together on various things since UCLA is developing innovative change in how they do primary care and so on. So the expectation is, particularly with UCLA, that should be a pretty good relationship.
And for those of us in the Office of the President that have been working hand in hand with Blue Shield to build this plan, I mean, it's a self-funded plan, so we're driving the benefit design, but they are the ones that are administering the plan for us. We have been very pleased with the collaborative partnership we formed with them. So we have no reason to believe that it's not going to continue. A couple,
Okay,
yes.
3 more?
With the health care savings, the health savings account, is the UC going to contribute $500 annually?
Yes.
Or is that a one-time?
It's annual. I'm sorry if I didn't mention that. Yes, every year we'll contribute either 500 or 1,000.
And along those lines, is there any place where I can read about how that's invested or what the exit strategy is if you choose to go away from that?
Yeah, Health Equity's website has a lot of information about how the money's invested. Once you get past $2,000 in your account, there are additional investment options. So there's a lot more to it than we could cover today, but Health Equity's website is excellent, and so are their customer service folks.
Right, and one of the big feature of a health savings plan, this is not our health savings plan, any health savings plan, is that once the money's in, it's your money. Whether you leave the university, whether we close the plan or you leave the university, that plan money stay with you. Okay, take that last one.
Say I have UC Care, I see my primary care physician and he prescribes an MRI. Do I have to pay any copay in that case for the MRI?
Yes, you do. So there are copays for all services. If you go into UC, the facility component will be at the $20 level. What is unclear, what I was trying to say earlier, the professional piece of it will either be at 20%, but we may be changing that to $20 if the service is available at all 5 UCs.
Will the lab that primary care physician prescribe?
So if it's part of your routine annual exam and it's routine lab work, say test your cholesterol every however many years, that is covered under preventive care. But if it's, a diagnostic lab work because of an issue, then you would have a copay for that as well. So I believe the current Anthem plans or the Plus plan, you don't have copays for those services. You will under UC Care and you will under the new PPO as well, the HSA plan.
But you'll have a copay with lab work and you'll have the deductible, or does it fall into that tier 1?
So there's no deductible for the UC Select Tier 1 level. There's zero deductible. It's called first dollar coverage for anything. Tier 1 has no deductible. Tier 2, it's $250 for an individual.
So all your lab work would have a lab, would have a $20 copay.
Yes.
You were getting it in a UC lab.
Exactly.
And that was the same question about the MRI that's $800?
Yes. So the lab piece of it, the professional piece is outstanding. So we'll get back to everybody on that.
There is also the issue, if there are 3 diagnostic tests that are being prescribed by the physician, is it $20 for each test, or, so that part has not been
Nope.
worked out in the way
Right.
that we've been
Nope.
trying to get.
Nope. Yes?
If you have chronic conditions
I think as Mike said, kind of the equation is, what I always do in picking a plan, even for myself, and I've been in the insurance industry for a long time, is I look at the premiums, I look at the deductibles, and then I look at my history. I have asthma, so I go to the doctor, so I look at what my spending had been in the previous year, and then I look at what the plan design is, plan A, B, or C, and then make a decision that way. So that's what I would encourage you to do, is look at all those components and then figure out what makes the most sense for you from a cost perspective and from a choice perspective.
Isn't there a calculator on the website?
There's a treatment cost estimator.
Yes,
But
on the Blue Shield.
Yeah, but I don't think that's available for us until January 1st. I mean, that's per procedure. I don't think it's for, is there another one? Is there another one?
The medical plan chooser.
Okay, the medical plan chooser, okay. That may help as well.
And is this presentation going to be up online?
A version of this, yes.
I'm going to have a full list of directory of all the doctors that are within this UC.
Yes.
So,
Because I tried to find it and I couldn't.
So it's on the Find a Provider. I have a card up here. I'll give you the phone number you could call as well. But it's online. The days of print, the days of printing directories is gone, because as soon as you printed those, they were already outdated. Yeah. Yeah. Yes.
I tried to find it 2 weeks ago, 3 weeks.
It wasn't up 2 or 3 weeks ago. and it's still not complete. The directory, as I said earlier, it's not complete. We are adding physicians as we speak, because the UC centers are sending them to us every day. Yeah, I've got the, yes.
Yeah, is it safe to assume that not all UC physicians are under the UC Select tier?
I would say 99.9% of them.
It refers to Jules Stein. Right now, I'm under Anthem Blue Cross Plus, and a lot of the Jules Stein doctors do not take tier with additional portion. They take PPO, so I have to pay PPO to see certain doctors. So I was
The UC Care Plan is a PPO plan. So I have, yeah. Yeah, I have no idea if they've chosen not to participate, or it was just an oversight and that was just one of the groups that was. I mean, this was just a snapshot to give you all a sense of what was not at all supposed to be an all-inclusive list. So that is, I've already written that down as a follow-up to figure out what.
UC Select, you can see any UC across the United California.
Yeah, absolutely. Yeah, yes.
For Blue Shield HSA, I see that the deductible is 1250. The contribution is 500. So in order to meet the deductible,
$750.
yeah, they would pay $500 and we're responsible for the rest of the 150.
Correct.
Yes, so you're, the,
The 2800 up to 3300, that's still the tax deductible, could we have it as part of Connexus?
Not Connexus.
you're not going to be using Connexus if you're in this plan. It's a health equity, and they have the health savings account. So the $2,800 that you can put into the health savings account pre-tax goes through health equity.
But the answer is yes. You can contribute the remaining amount on a pre-tax basis, but you'll be using the health equity vendor, not Connexus. That's all. Exactly, you
Yes.
can.
Yes.
Okay, last two questions. Connexus will exist for all plans that is not the health savings plan. Okay.
Okay, we're
Was
gonna,
it-
we're gonna take 2 more questions,
All right.
and then unfortunately, our Office of the President representatives do have to head down that 405 to get to the airport, so they don't have to reply. But just a reminder, please
I know.
refer to the website for additional questions, and as they
There's
mentioned,
one right
they
there.
still
Okay,
have
last two.
more information for you.
So, for the UC providers, was it a mandate or high recommendation for them to join the system?
It was not a mandate, but all the medical center CEOs were very, very supportive of this, because it also potentially increases volume to their own facilities. So it's not like we dragged anybody kicking and screaming. It was not easy to come up with a number, I will not lie. But no, they really see this as an opportunity, not just to grow membership among our own faculty and staff, but, healthcare is changing. There's accountable care organizations are forming, and there's going to be new ways to pay for care and coordinate care. And I think they see this partnering with us on this new plan as the first step to be able to really survive in the new healthcare delivery system.
Last question.
For the combination of Medicare and Anthem Blue Cross High Option, what is the best alternative going forward? You referred to the Blue Shield program?
Yes, so for high option and PPO Medicare, there's a Blue Shield equivalent of it.
That's listed under the...
No, remember, that's for pre-Medicare and faculty and staff program. This presentation does not address the Medicare side of the house. What you're looking at is not a Medicare sheet.
Where could we get information about the Medicare part?
So remember, we're 2 weeks away from open enrollment. On a normal year, you will not see anything from us till like a week before open enrollment. That's when we normally mail stuff. Just that this year, we're coming out early, and so we haven't got, you will get, as a retiree, you will be getting an open enrollment a packet from us, and that's where all your information will be in the next 2 weeks. Okay.
Or you can come on October 28th.
Oh, thank you.
Fair at the Faculty Center from 8 to 12. Everybody will be there to answer questions, including Bridget Sheehan Watanabe, our healthcare
Okay.
facilitator.
I'll take yours, but please come down, but you've been waiting very patient, so I want to take yours.
Any important change to the core plan?
No, the only change that's happening to the core plan, which is $3,000 deductible, the out-of-pocket maximum is being reduced, which is an improvement. But other than that, that's it.
Okay, thank you. Thank you, everybody.
Being administered at Blue Shield, right?
Oh, yeah.
So there are no Anthem plans left?
No.
And SHIP is still Anthem though, which is